Welcome to another informative episode of Health Talk on Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, the federal government has heightened surveillance at all points of entry into the country following the outbreak of bedbug infestation in France and other parts of Europe. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, disclosed that the ministry remains committed to ensuring that appropriate public measures and responses are put in place to contain the bedbug infestation nationwide. According to press statements released and made available to Captain TV, the minister revealed that the ministry has developed a draft sheet which will be in circulation soon to strengthen awareness and health education on the control of bedbugs. Party urged the public to cooperate with port health officers at points of entry in the course of their surveillance activities. And federal government advises that early detection is key to controlling their infestation as they are capable of putting everyone at risk. Now, bedbug infestations have become a growing concern affecting homes, hotels, healthcare facilities, and a wide range of environments. These tiny blood-feeding insects not only cause physical discomfort, but also raise significant environmental health issues. On Healthy Living today, we'll delve into the multifaceted world of bedbugs and their impact on public health, as well as explore strategies for prevention, management, and environmentally responsible solutions with an expert in environmental health, Sanitarian Egene T.E. He's the Provost Environmental Health Officer Association of Nigeria, FCT chapter. You're welcome to the studio this morning.
Thank you for having me once again.
Thank you for coming.
Thank you and
cold.
Good morning.
Good morning.
You're welcome.
There's been a lot that has been said about bedbugs lately. In fact, the usual thing that we knew about bedbug is that maybe it could infest people's homes, and then especially starting with their couch, their bed, and it tends to spread really fast. Can you help us make sense of what is it with this bedbug infestation?
Yeah, thank you once again. Bedbug infestation is not a new thing. It has been there, in fact, for more than 300 years back. But the high infestations that just recently occurred in France now is a concern to public health, and all hands must be on deck to see how to ameliorate the impact that it might cause on health and human life. Talking from the perspective, bedbug is a wingless insect, meaning it doesn't fly. But they dwells in our home. They lived with us, especially in an overcrowded environment. Bedbug majorly were very active at midnight from evening to around 5 a.m.
Wow.
And this period will cause a lot of discomfort to people, to family that experience such. Depressions arises from it, right? Then the social embarrassment that it caused to people that move around with it when they see it. And it can move from place to place with the luggages, with human being probably in the pockets, in the body. You can quickly contact it from your neighbor in the vehicle, in the park, in train stations, at the airports, hotels, hostels, schools, and every premises. As long as there's the presence of this pest called bedbug, there's high level of its multiplications when there's a conducive environment for it to multiply. And majorly, it doesn't like heat. It doesn't like light. That is why they perform very effectively at night.
Oh.
Yes. So.
Okay. Now I'm beginning to wonder, at some point growing up, you find people bring out their mattress, their couch under the sun. They'll say they are chasing away bedbugs, but I couldn't relate how that could be until you mentioned it now, that they don't like lights and all of that.
Yeah. So when they were very active at that night, they don't like sun. So for you to control it a bit is to take all your luggages outside, then disinfect the room the environment. This bed bug can also pass through one room to the other, either through the pipe, the wire that connects it, through the AC pipe, and thereabout to another person's room. Before you know it, the infestation becomes so wide if there is no proper measures to curtail it at the early stage of infestation.
Oh my God. So which simply means, okay, now I understand why the Coordinating Minister of Health, Professor Ali Pate, is actually making efforts to ensure that even at the border, there's proper surveillance to stop it from getting into the country. But that's if it's not already here at our doorsteps. But let's talk about the risk, the health risk associated with bedbug infestation and the impact it could have on an individual.
Yeah, from the research so far, bedbug is not known to cause any disease. Unlike mosquitoes that cause malaria, especially the type we have in Africa that is causing a lot of malaria parasite to us, Vibrio cholerae. That's the causative name. Or flies and cockroaches that cause different kinds of disease in our environment, discomfort, and gastroenteritis, a disease that disturbed the intestinal canals, leading to typhoid, cholera, and dysentery. But in terms of bedbug, the only thing that it causes to human is the bite. And when it bites you, especially at that night, you'll be disturbed of your sleeping. And as a result of their biting, you'll be scratching the place. It will be sweating you. As you are scratching it, it will sweat you until you wound yourself.
Wow.
As a result of wounding yourself, bacteria can form and then cause an infection on that site, leading to serious health problem. The allergic reaction that comes as a result of this scratching and biting is another serious problem that can lead to skin infections. You get. Then, talking of the sleepless nights, that people do not sleep, you don't sleep at night, you have sleep depression, normally known as insomnia. That's when someone have a sleepless night. So this insomnia, when you don't sleep at night, the bite continues. You have sleepless night. Then by 5 o'clock a.m., where the rate of biting reduced because the day has becoming so open, that is when you sleep. Now you are to resume at office by 7 o'clock. Bedbug do not allow you to sleep from 8 o'clock or 9 o'clock in the evening to 5 a.m. Then between this 5 a.m. to 7 o'clock is when you have time to sleep. Probably you're late for work. And when you're late for work, your boss will query you. And when your boss query you, psychologically you'll be affected.
Of course.
Then as a result of that, it also reduces your production, because when you resume at work, instead of you to focus on way forward for the office, you'll be feeling dizzy because you did not sleep well at night. So some of those things are factors that pose the risk associated with bedbug infestations, right? Then do you talk about the stress that come about it? Many people don't want to go back to houses to meet their family, because if they go house, there will be no peace for them because of the bedbug. So a lot of people prefer to hang out at beer parlors
instead of being at home.
Instead of being at home with their family, at beer parlors and be smoking, leading to what? Some mental disorderliness. So some of these things are factors that we should consider. Since bedbug do not cause any health, any disease, but pose some factors that may lead you to sickness. If you are depressed, psychologically you are disturbed, and it will affect your being.
Sure.
So the best way to do about it is to treat it, prevent it from it happening before it gets to the higher infestation as it were in France.
This is beginning to sound like a pandemic that may befall. Let me not be a prophet of doom, but it's beginning to sound like a pandemic. Now, because they are described as blood infesting insects, if that's the right way to describe them, don't they have an impact on our blood the moment they start biting? They don't transfer anything into our blood streams and all of that?
They are known to carry some bacteria on their body.
Okay.
But that bacteria is not active on human body.
Okay.
So if they bite, the only thing it can cause you is this irritation and scratching of your body. But high infestation of it, if left untreated, can reduce your blood. Imagine when 1,000 bed bugs feed on you throughout the night. You see it. So it may probably reduce your level of blood cells in the body, which may affect you also negatively. But causing any problem, any sickness, apart from this depressed and lack of sleepless night, itching and scratching of the body that may lead to infections, bedbugs do not cause any health or disease. It causes health risk, health challenges, but it doesn't transmit any disease. It's not a transmissible pest like cockroaches and mosquitoes.
All right. As an environmental specialist, because you have experience, is it possible to, get into a home and detect if there are bed bugs there even before you start your search from your experience?
Yes, because when you get to a premises, as an inspector or as an environmental health officer,
I would like you to answer as both of them, because I know you double as both. You do both jobs together.
Yes.
So
environmental health officer is the inspector.
Okay, great.
So when you talk of environmental health officers, you are not limited to only inspecting, but you have over 24 components in environmental health.
Okay.
So what we are discussing, prevention of pests, is one aspect of this aspect of health, environmental health. So when you talk of this bed bug, right? It does not cause problem. The problem it caused, and on our part as inspectors, when we come to a premises, you can quickly detect it. One, through the mattress, the lining of the mattress, the furnitures at home, the wall or the curtains. There are signs that if there is a bed bug infestation in these premises, you will quickly notice it. Because when they bite you, they move around and release those bloods one by one on the wall, on these bed sheets, on the curtains, on the furnitures, on the chairs. So when an inspector enters the premises, you quickly detect that. Apart from that, the odor that comes from the infestation of bed bug alone.
Okay, it has a specific smell.
It has a specific odor.
Okay.
It has a specific odor. The moment you enter a premises, you perceive this odor. As a professional, you should know that, wow, there's bed bug infestation in these premises. Then you begin to look at the hiding places, like the lining of the mattress, the clothes, the shirts you've not used before. Check the pockets, check the collar. It will hide there. And that is why after hanging some clothes for a while, it is important you spray it in the sun for like 30 minutes before you use them. Because when this bed bug hang there and you take it, you start going to work in the car, somebody might say, wow, okay, you carry bed bug.
And that's really embarrassing.
And that is embarrassing. Because back then in primary school, I used to have some people that come to school with bed bug. So whenever we see them, you have a bed bug. And before you know it, especially those that use white
they'll kill it on it, and then the blood
they'll kill on it and the blood stain it. And that blood is very difficult to be washed away. And as a result of that, whenever you come, see this one, social stigma. See this one, a bed bug carrier, no near them. Before you know, you'll be isolated. Only you. Nobody wants to near you because nobody wants to go home with bed bug.
Wow. So now that's you talked about it from the perspective of an expert how to detect bed bugs in a house. So now let's talk about, what about individuals? What are the signs and symptoms that we need to, observe to know that our homes have actually been infested?
Now, what you need to observe first is to check regularly
How
in your household. You look around it. If you see bed bug, you know it.
Okay.
Like I said earlier, bed bug is a wingless insect. Some are black, reddish in color. So whenever you see them, in fact, you see it, their actions alone will tell you, except you are maybe somebody that have not heard about it before.
Okay.
Yeah. When you start noticing some of those things, you communicate with people around you. I'm seeing so these things, so I don't know what it is. If you call somebody to come and check it, they will tell you. Those who knows will tell you what it is. In different languages, they have the names.
Okay.
Like in the aspect of the tribe I came from, we call it Ipele.
Okay. I think Yoruba call it Idun or something.
You do. Oh, you
Yes,
see it now. So,
I think so.
You can see every languages have the way they call different kind of pest. So this Ipele, this bed bug is very active. Whenever you see them, if you don't, before you close your eyes, it don't go.
Wow.
Unless you are very
fast.
smart to follow. They are very fast because they don't want to die, and they can live for more than 6 months, even without feeding.
Wow.
In a conducive environment, they can stay there for 6 months without feeding.
And they need blood as their food.
And they need blood as food, and not anyhow blood, human blood.
Wow.
So your presence gives them comfort.
Oh, I see.
So when you are not there and the environment is not conducive for them, they can die, especially during heat period. When the weather is cold, they are very confident to stay and live with you. So as a layman, if you start noticing that, okay, in the night you don't usually sleep like before because of biting, you don't know what is biting you. First is to, if you have touch, to stand up and check. But if you cannot stand up, when they break, check the lining of the mattress. Check your wardrobe. And one of the things that will help us to reduce it is, some people have this bed, special bed, they have never moved it for 10 years. They leave it there. And once you leave it like that, anything that comes there will stay there. Like, if you go to some hospitals, I visited a friend in the hospital recently, and I noticed that there are bed bugs in the hospital.
Oh my God. So people go to hospital for treatment and come back home with bed bugs.
So when you go to a hospital like that, check. If there's bed bug, know how to protect yourself. Because if you talk to some management, they will not even take you serious. They will tell you that the bed bug has been here before you came, and it will be here before you go. So just receive your treatment and go. But if you are not careful, if you are careless, you take this bed bug to your home. And when you take it to your home, it will stay there. One can start giving birth, lay the egg.
I was going to ask that question, to ask you how they spread. Because I'm thinking, if bed bug actually reciprocates and they give birth to other children, procreate rather, if that's what happens, is it not possible, and only one follows you, how will that one have children just alone? Or they move in twos and they never move alone? It's been baffling to me.
Sometimes they don't move in twos. Only one that is already has can go with you. And once they lay the egg, one can produce 7 to 10 eggs.
Okay.
Within
so only one
can
lay eggs.
Egg.
That means it's not gender based. It's not like bedbugs that. Oh.
No, it might be as a result of the infestation. This is already have the egg in the body, and you move with it.
Okay.
If you notice and kill it, you have control the risk they spread. Now, if this only one come to your house and lay egg, give birth to 7, or 10, as the case may be. This 7 now, you can see
that's
that
their own
this
7-7,
have
49.
their own 7-7, 49. The 49 will get another 7-7.
Oh, goodness.
That is how it become so plenty in your place. And if you don't control them from the beginning, you visit a friend, you go with it. A friend come to your place, pick it to another friend. Before you know it, it become something that is in every home.
So what are the other signs? Aside them moving with you, how else do they spread? Because this is really something we all need to pay attention to.
If they don't go with you, they can move with your luggages. They can move with you in the bag, either in the shoe also, in your clothes, in your laundry. They can move with you to any places. That is why the surveillance at the point of entrance is very, very important. And in doing so, there are certain things the government need to also look into. One, the embarrassment it caused to the people. If you see somebody and tell the person that you have a bed bug in the body, the person will argue with you. Some can even sue you for you to say that you have a bed bug on their body. And once this thing, you remove it, it's not there for you to capture it as evidence.
Of course.
And this person will tell you that it is not from my body. What will you do?
Exactly.
So you need high level of people who are vast in communication, who know how to approach people to do the work. Otherwise, they will cause more problem to the government.
But you know what's another question I would ask is, why the sudden resurgence of these bed bugs? Because it's in the past we heard of them. Why are we having a resurgence? Is there something wrong somewhere, somehow?
In France, probably it's as a result of the heat period.
Okay.
And people moving from place to place, hotel to hotels. If it's not taken care of, this is just because we are hearing it because it's in another country. If it's in our own country, Nigeria, everybody has shy away from speaking out because of the social stigma.
True.
Because of what people will say about them. So now that is that place and the information has reached us, it is better for us to map our that personnel at the point of entry, those that knows how to approach to identify this problem. And it is not only ends there. What about their luggages? They come in with luggages. And what thing they need to do now to ameliorate this issue is to educate people, just like what we are doing here today, to sensitize the public on the need to prevent this bed bug from coming into our country. At the point of entry, they should map those environmental health officers whose primary responsibility is prevention of transborders of disease at the point of entry. Then, the same people should do a thorough disinfestation of their luggages when it comes. This has to do with chemicals, spraying of chemicals on their luggages. So
just like they
people
do
need to
during
know,
the COVID-19 at the airport.
Yes, they should know that, okay, doing this will help them. So that when they see chemical or water on their bags, they should not complain. Otherwise, before you know it, they'll start reporting the airport management that they don't know what they spray on their luggages. So enlightenment and sensitizations need to be strengthened, especially at this point in time.
Okay, but can we look at it from another angle? Like, is it possible that bed bugs infest some homes because of lack of cleanliness, hygiene sake? Is it possible?
Yes. One of the things that brings about bed bug is improper hygiene.
Okay.
When you talk of improper hygiene, people leaving their bed sheets for weeks without washing, then how will you notice if there are things on the bed? You leave your bed for 5, 6, 7 years without even shifting it from where it is.
Changing locations.
Changing of locations. You have your wardrobe. You have not changed location since you put them. Right? You start noticing some of these things, and you are not taking cognizance to know what is even happening in your home. So poor sanitation is one of the factors that promotes the infestations of bedbug in our home. And not only bedbug, a lot of pests that grows in our homes is as a result of a conducive environment. When you give them a conducive environment to stay, they will come comfortably and be with you. And as a result of being with you, they keep multiplying, keep multiplying.
Thank you very much, San Egene. Let's go on a quick break. All right, viewers, let's go on a quick break. When we return, the conversation continues. Stay with us. All right, welcome back, viewers. We're still discussing bedbug infestation with San Egene T.E. All right, sir. Before we went on the break, you were trying to give us a few insights into how to manage this bedbug infestation. And you talked about hygiene, poor hygiene as part of the problems. So talking about this poor hygiene as an issue, so are you trying to say that how regular are you trying to say we need to keep checking our homes? Because you mentioned regularly. So how regular is regular?
Now, in terms of checking your home, there's no specific time for you to do it. One, it depends on your schedule.
Okay.
And how to rearrange it if you have scattered. One thing is to scattered, another thing is to rearrange. So if you have your time, if you can do it every month, at least it's better. By if you come house, you can raise the bed. Some people have not even turned the second phase of their bed since they bought it. So it is important you check it and turn the face so that the other face that have been suffering will enjoy while this one. So in so doing, you notice if there are things that are hidden.
Sure.
It is not only bedbug. Scorpions can hide within that place.
Wow.
Wall gecko can hide and be living with you in your own house. Right?
Of course.
Cockroaches can hide and be living with you. So in the process of doing that, you sweep them all away. When you sweep out, you inside the deaths, you can look at it and see what are the things that have been enjoying your room with you. So if there are signs of bedbug, you start taking measures to control it from that point.
Okay.
But from the biting itself, you should know that there is something here that is disturbing you. And that should even give you first impression that, okay, I need to do a check of my premises. Let me see what is causing this. In the process of inspection, you notice this is where it is. You shift your bed, you see it. What do? You have to take the bed out, pack everything outside, and do a thorough sanitation in the premises. In the case of hospital, it can also be done like that. In the case of hotels, it can also be done like that. In the case of schools, especially hostels, I could remember in 2020, that was May 6, 7 precisely, in 2020.
Okay.
We went to one government secondary school in FCT. I will not mention the name.
Okay. Yeah, it's better not to mention the name.
When you go to this school, in fact, it was my boss they called that see what we are having here. The children are not sleeping. In fact, the whole hostel was infested with bedbug.
Wow.
The whole hostel, right from classroom to their hostels, office rooms, is infected with bedbug. What can we do? They call him and they discuss, because it demands a high professional experience to treat bedbug. Otherwise, you think you'll be doing it yourself, and at the end, it will still remain. So a professional know the angle they can treat it from. the products, the chemical to use to kill it, in fact, totally. So when we went to this school, the infestation was much. The children were complaining, biting here and there. They don't know what they do. And the parents are not responding to their cry. Some will even go and protest that, okay, Daddy, I don't want to go to that school again. I don't know what is biting me every time. The parents say, you must go there. Until the PTA notice that, okay, this is what is happening. And they call our boss, they discuss it. When they do a thorough job for good 5 days.
Wow.
And that doesn't stop it because it's a professional job. After this exercise, there are eggs that you might not reach at the first exercise.
Okay.
So you need to come back after a week or 2 weeks to see the level of control and to see the ones that remain. And at the same time, treat it all around again. As a result of this, the school were treated free of bedbug infestation. And they have not been complaining till now.
Wow. This, the way you talked about it is sounding as though it's a lot of process when it comes to, taming these bed bugs in the bud. But now let's talk about using of pesticides, to kill bed bugs. Does it have any environmental concern when it comes to if we can use pesticides in our homes and all?
Yes, that is why it is good. You can use pesticide, but consult an expert.
Okay.
The type of pesticide to be adopted.
Okay. What's
And
alternative?
in generally, why not allow the professionals to do it for you? One of the problems we have in this country is everybody believes I can do it. Everybody can talk, but is it everybody that can do MC?
At all? Definitely not.
So you can talk, but you have occasion, you will be looking for MC. Why don't you do it yourself? If you have this kind of scenarios, look for experts. If the expert cannot control it, hold him or her on his or her neck to do it for you. Because they are trained on this aspect to do this job. And they know what and what. If they use this product today and it's not working, they know the next product to adopt or to apply to make sure that your case is terminated. Now, in the case of this, like there is a place I went to treat termites. Termite has been disturbing them. They buy chemical upon chemical and control it, but it doesn't go. When they reach out to me, I say, that is just a minor case to me. They say, okay, let's see your professionalism. They call on me, I came, I treat it. For over 3 years now, they have not seen one single termite in their home again. But as at that point, termites have eaten up all their cupboards, all their wardrobe. Yes, eating it up. It started eating on the clothes, going into the ceiling.
Oh, wow,
That is how
bad
deadly and badly it was. But when I came, I give my best, and to the glory of God, man cannot do it alone without God. So I was able to control the termite. And the woman was, how do you do it? This is my field. It's not everything you should know.
So the alternative you're recommending is always sort an expert to...
Yes. We have licensed environmental health officers who can do it.
Okay.
Licensed, registered and licensed, they can treat it effectively for you without you noticing it any longer. We have other companies who are registered with the council, that is Environmental Health Regulatory Council of Nigeria, who are registered, they have the license to practice. Okay. So you can also consult them to do it for you, so under the supervision of a licensed environmental health officer.
Okay, so it's basically the role of environmental health officers to handle this.
Yes.
So how do we go about it when we need the services? Because most of the time, it's just, when you're down health-wise, you go to the hospital. So when you have this kind of case, where do you go to? Can you share insights with us?
Now, when you have this kind of cases, we have Environmental Health Association of Nigeria. Is in all the states.
Okay.
We have the national bodies that control the association, right?
Yes.
We have the regulatory body in federal secretariat. As at last 2 months, we were in Geriki by AUDC, that is close to that Sugar Regulatory Council, opposite Meat and Press, right?
Okay.
That is where the office was before. But now we have moved down to federal secretariats. People do not ask questions. That is why they don't get the service they needed. Like now, I am the provost of FCT. There is no any environmental health officer in FCT that I don't know. So if you need the service, you go to the office, you get it. If you go to Federal Medical and Health Workers Union at Area 1 by Zidurumi, Ayuba Waba House,
Okay.
that is, we have an office there. If you come there, you ask of any environmental health officers, you get it. If you go to all the area councils, they have environmental health departments. They are there. Those area councils have franchise with other pest controllers. That is other companies that registered with them to carry out this exercise.
Of course.
One is in Duse here. Duse, by that mobile police station. If you ask of environmental health officer in charge of pest control in Buhari Area Council, you get it there. If you go to Gudu, by Gudu, that is after that police station, there's one plaza by the left. The office in charge of AMAC
Is that too?
is there. But there are just the regulators. The field workers are there who you contact. When you go to the office, they will give you a contact to communicate with, and your problem is solved. But people do not know that this service is rendered by a professionals. So professionals need to handle it best for you.
Well, another thing, we know professionals need to handle it. There are some cases where professionals just look at you like, why are you so dirty? And they judge you first before they handle this thing. So it makes some people not even want to speak out. Instead, they'll just ask from their neighbors. They will say, go and buy this one, it will work. Buy this one, put this one here, or use this alternative or that or that. So in that case, how do you begin to handle such situations?
Now, that is why I say that professionally, no matter how dirty your premises is, we have a way of approaching it. At the end, you will be smiling, we'll be smiling.
Sorry to cut you. I still remember some persons will say, if we call them now, that's when they'll come and fine us for one thing that we did not do, or another thing. You know, you guys are also inspectors, so you tend to inspect a lot of things. So from wanting to fumigate somebody's house, you may discover some lapses that they are lacking and say, okay, you have been fined this, find that. So please put that into consideration as you answer my question.
Professionalism. When you are called to do your job, focus on the job. If I come here to do pest control for you, even though you have $10 million in this room, it is expected of me to close these eyes and do the work that brought me.
Yes, but I'm not even looking at it from that angle.
No,
okay.
Is this the same thing?
Okay.
Just using that scenario.
Okay, as an example, okay, I get it.
Like, if I come to a premises and have a lot of nuisances, that nuisance might be the reason why you even called me. A professional will sit you down and educate you. See this thing, see this one, see how you do it, see how you clean here. If you do this, you are preventing this one that you called me for. Just like you have a lot of luggages packed in one place. For 1 month, you have not gone there. That place has been a harbor for reptiles, for snakes, for scorpions, for cockroaches, for bedbug, which we are discussing. Now, if I come there for rat infestation, if I come there and told you, these things that you left here unattended to is the reason why you have this infestation. So you will be educated on the need to get rid of those things to prevent further future occurrences. But if you are not a professional, you come there, your own is majorly on revenue generation. That is where we get it wrong. It must not be money all the time. When you do your work perfectly, money will come. If you come in for fumigation, we discuss about fumigation. You are paying me for my service. If I come there, I do the work, you pay me. If there are areas you need to do, like in some type of premises, if I come there, you need to buy cement in order to seal up some holes. So are you looking at that as a burden to you? That will make my own work to be effective. If I don't correct it, I'll close eyes to it. That means I want to be coming there every week. Financially, it will affect you, because the money you're supposed to use for other things, you'll be using for a particular purpose.
To service it.
But when you buy the cement and seal up the premises, it will cover the next expenses that you are going to do. So when I come to your premises and do inspection, I make sure that what is not right in your premises that will negatively affect your health, I will tell you to do away with it. But if I'm there on official inspection, I will tell you, do this. I will be very, very frank with you. You have to do this. If you don't do it, this is the implication. That is when fine comes in.
Okay.
And fine, you are not to even fine the person. Though the regulation shows that if you don't have a waste bin, you'll be fine. If you don't have toilets, you'll be fine. Those fines will be accumulated to a bigger amount. But there's how you can do about it by taking protective measures against those things from happening. Get the dustbin by yourself, then do the necessary things. So if we come for house-to-house inspection, there are a lot of things to check. And at the end of the day, a report will be written to you to know the areas you are doing well and to know the area you need to sit up. So inspection is not all about condemnation all the time.
No, because that's what we see most of the time. Condemnation rather than education.
Majority of those people, let me say, the majority of those people are in for revenue. They are in for revenue generation. And when you focus on the revenue, what about the work? Okay, I can pay for the revenue, but you leave me with the problem. And that problem you leave me with will affect my children. My children will take the same problem to the neighborhood and affect the neighborhood. Before you know it, it becomes a general problem.
So let's talk about guidelines for managing bedbugs. Are there guidelines for managing bedbugs in different, settings?
Recently, there are. It's just that this is just coming up. The government are working on the guidelines.
Okay.
Yeah, just like the Minister of
Coordinating Minister of Health.
Coordinating Minister of Health and Social Welfare, right?
Yes.
Professor
Ali
Pat Ali, that come up with this information that surveillance should be very strict, and they are working on documents to help the law enforcers, that is the port health officials at the point of entry, to do their work properly. The Ministry of Health, Environment, which is the coordinating minister of anything concerning prevention and control, are also working on their part to have a document regarding these particular cases. But generally, there are policies that have been there long time ago in terms of prevention and control of all these pests in our environment. Not because bedbug is coming, they are doing it. They have a policies on ground that, okay, in the case of mosquitoes, see the control measures. In the case of bedbug, see the control measures. So, but for people to go back to those documents and see, as well as working on the document, is now the focus.
Thank you very much for that insight. Now let's talk about some of the major means of awareness for the public, especially now that this bedbug is now out for us. The coordinating minister talked about bringing out some flyers and handouts that people can also use to educate themselves. But aside that, what measures is going to be put in place? Aside this one you're doing here now, are there other things that should be done or that would be done to help people know that this is how to stay away from bed bugs, this is how to stay safe, this is how to protect your home from infestation? Because almost all the time people have guests. Your guests can come with bed bug. So how do you begin to manage all of these things? Except, and they said it's except you have an understanding of what to do, you may never know what to do. So that's why I'm asking you this question.
Now, just like why I'm here is to create awareness and sensitize the public on the need to get rid of bedbug infestation. Now, the coordinating ministers have come up with this information. So, getting the flyers will be a very good one. And it is also expected of others to go to radio houses, especially in the local communities where they might not have access to light always, to talk on the radio stations in languages that they can understand, in different languages, in Hausa, in Yoruba, in Igbo, in TV, in every other languages in Nigeria, in Igala, right? So if they do that, people will get to know this bed bug. Many houses are also having it too. Forget that it's coming from other countries now. The one coming from other countries is not different from what we have in Nigeria. But for us to be aware and take proactive measures in terms of controlling the infestation is the best. So going to that media houses, going to television houses, giving out flyers, educating people would be a better way to go. And then at the point of entry, let there be manpower. Manpower should be there. Nigeria should always not look at when there's an epidemic before they look into engaging personnel. I could understand in 2014 during Ebola, when Ebola came, they do a lot of things to get it off, to the point of even seeking for employment of environmental health officers. Many people go to Port Harcourt, Enugu, Lagos, Abuja to do interview, but till today, the job did not come to pass. So the coordinating minister of health should look at that circular in 2014 and as well engage the environmental health officers at the point of entry for proper surveillances. Then, in doing so, there should also be communication, a kind of collaboration between the ministries, the Ministry of Aviation, the Ministry of Health, and Ministry of Environment, for us to tackle these issues, and security are not left behind. Then, in the primary schools, they should look at inculcating all these knowledges into the little ones, because they are the ones that have the vast knowledge to do with some of this information better than the old ones now, because of the high level of intelligence. So if the children are being trained at the school level, at the grassroots level, they grow with it on how to go about the infestation. So bringing out flyers is a very good one. Sensitizing the public is another good one. So when these things is done, it will help to control the infestations of bedbug. And not only bedbug now, it helps to control other pests that may likely come as a result of our practices, as a result of our ignorance, because a lot of people are not aware of this kind of issues. So at home, individually, clean up your home, wash your mattress, your bed spray, spray it under the sun. If possible, iron it before you use it. Regular changing of your bed and furnitures, right? Regular changing them will help you to identify when there's a bed bug for you to control it. And when it becomes so worrisome to you, seek an expert knowledge who will help you to control them.
You know, I'm sure some persons, as they're watching at home right now, they're already saying that it's people that have eaten that have money to go and do sanitization of their homes and all of that. Do you think living conditions actually impact this risk of some of these pests, bedbug as our focus? Do you think living condition actually impacts it?
Yes, seriously. Living conditions is one of the factors that also contribute to the infestation of bedbug. One, when you have like 10 children and all of you are living with you and your wife, that is 12, all of you are living in 2 rooms. You can see that overcrowding. Also, you have your clothes, every other person have their bags surround the place in just 2 rooms. You can see that the living condition will automatically affect the infestation of bedbug because the place will definitely be overcrowded. And as a result of that, there will be no space, breathing space. And bedbug like a hidden place. So when you provide an environment for them to live, they will definitely stay there without thinking of going elsewhere because you have provided for them all they need. If it's food, they have about 12 to feed on in the
12
in one
Lord.
night. You understand? So they have about 12 to feed on in one night. So, and when they want to hide, they have enough place to hide and stay and live with you comfortably. So you'll be providing them food while they live with you. So living condition is one of the factors. So in doing so, if you go out for inspection and identify source, in your own wisdom, how can you help? It is not always government to be taking. Go out for revenue all the time. What can you do to help people? Like my NGO, Grassroots Environmental Healthcare Initiative, we don't go to people to collect. We go and give. We sensitize them. We give them health talk on menstrual hygiene, on waste management and control, on open defecation, on hand washing, and it's important. So whenever we go out like this, we talk, we give diapers, we give hand washing soaps, we give sanitary waste bin, rakes, brooms, packers, and all those things. We issue to schools. We issue to the market people. Like recently, we're in Wuse Market. We do a lot of sensitization. There we clean and tell you the need for you to do it and prevent you from sickness. Because when you are sick, you cannot come to market.
Any last word for our viewers?
Yes, for our viewers, it is important for them to know that bedbug is not a death sentence. The infestation can be controlled. And by controlling it, by doing all these things we have mentioned, they have reduced the way the infestation can go. They should not be afraid of any environmental health officer. They are there to serve you. They are public servants. They are there to serve you. But know the manner of approach. Transfer of aggression can happen when somebody is down and you are coming to tell him to do this in his home. The person might not be happy about it. So prevention and control of bedbug is the way forward. And general environmental sanitation is the way forward. The health of a single man is the health of all. If you are healthy and wealthy, you can enjoy your money. But if you are not healthy and you are wealthy, your money will go for treatment. So which one do we go? The option is ours to choose.
Indeed, the health of a single man is the health of all. Thank you so much, Sanitarian Egene T.E. Thank you. Provost, Environmental Health Association of Nigeria, FCT chapter. We really appreciate you.
Thank you for having me.
Thank you too.
Yeah.
All right, viewers, that's how we'll draw the curtains on today's show. I hope you've learned a thing or two, and I hope that you take your health very seriously, especially your environment. I am Olamide Al-Hassan. I'll see you again next week. Bye.